injuries. Stage 3 pressure injuries identifies with a full thickness loss. It usually extends into the subcutaneous tissues or the fatty layers of the skin. You also notice some kind of undermining around it, or you also see tunneling, but it doesn't get into the muscle, or you don't see any tendon or bone exposure in this stage. You also see slough on the wound bed or some kind of eschar on the wound bed. These are all dead tissues that you see on the wound bed. So this is how you identify your stage 3. So now, how do you manage these injuries when you get them? Management of stage 3 pressure injuries begins with repositioning, getting the pressure off this area. Okay, so redistribute the pressure through active patients repositioning. Ensure that they are not laying on that position more than 2 hours. If you do not reposition them, you risk the wound getting into a stage 4 pressure injury. Good hydration and nutrition is paramount in healing these injuries. If the person has limited oral intake, you want to add supplements to ensure that they're getting the good nutrition that they need to help with wound healing. Ensure you're increasing protein in their diet. If they have to get protein supplements, check with their doctors. If it's safe to do that, please go ahead and get them good protein. This helps with wound healing. Ensure that they are drinking well, they are well hydrated, to also help with the healing process. Now we are going to talk about the wound bed preparation. That is how we deal with the wound itself. First of all, you want to make sure that the wound is not infected. So you look out for signs of infection. Some are redness around the wound, warmth around the wound, increased drainage from the wound, as well as foul smell. Usually you don't call for infection with just one sign. You usually want to look for 3 of these signs, then you call for infection. So you ensure that the wound is free from infection. If the wound is infected, it's not going to heal. It might even extend into a stage 4. And then you want to clean the wound bed. As I said, stage 3 has slough or eschar, dead tissue on the wound bed. You want to clean that. That is what we call debridement. But there are different ways of debriding these wounds depending on where you work, your skill, and also